there. You're watching Brass Tacks on CNN News 18. I'm Maha Siddiqui. The most contagious variant of COVID-19 yet, Omicron, is here. Karnataka has confirmed 2 cases of the variant already. There are at least 5 more states where there are suspected cases of Omicron. The variant is new and studies are still underway on its immune escape. That is, whether the existing vaccines will be fully effective against Omicron or not. But many experts believe that it will still provide a basic protection from severe symptoms nonetheless. Several countries like US and UK are actively pushing their citizens to take booster doses so as to ensure the protective shield exists. India has no dearth of vaccines now, and there are those who are keen on a booster dose as well. So why not start the process in time? What's preventing India from taking a call? We'll be debating that issue over the next half an hour. But first, let's try and understand where this hesitation could stem from. In India, the dilemma still remains. Should you fully vaccinate every adult first or start with boosters to those who need it and are willing to take the jab?
In the war against a Hydra-like virus with multiple heads cropping up in the form of variants, do your antibodies need a boost? The US president certainly thinks so.
Do not wait. Go get your booster.
The vaccine makers believe it too.
In both cases, boosters should reduce dramatically the gap.
And now even the world's foremost health expert has given the nod.
Should I wait to get that boost? And the answer is no. If you are eligible, namely if you've had the Moderna or the Pfizer and you're 6 months following your primary regimen of vaccination or you're 2 months following J&J, don't wait. Get that extra boost now.
With Omicron now in India and predicted to be at least 3 times more likely to cause reinfections compared to Delta, the focus is back on the booster debate more than ever before. The Serum Institute of India, which produces the vaccine given to 90% of all Indians, has already sought approval for Covishield as a booster dose, citing adequate stock availability in the country. The opposition has asked the government questions in Parliament.
बहुत से हमारे वृद्ध, हमारे दादा दादी, नाना नानी हैं जिन्होंने 2 डोज ले लिए हैं, पर उनको और हम अधिक संरक्षण देना चाहते हैं, उसको हम बूस्टर डोज देना चाहते हैं. कहां है आपकी बूस्टर डोज पे पॉलिसी?
But experts in India believe that the booster dose isn't the solution for all our concerns, given that more than half the country is still to be vaccinated.
What we should be really debating is, have we vaccinated enough number of people? There is a huge number of people who had 1 dose of vaccine. They haven't taken the 2nd dose. So everyone who had the 1st dose should run and get their vaccine. And then at some point of time when that is covered, government will be very comfortable in opening it up for the booster dose.
Which is why India's policy as of now remains wait and watch.
जैसे जैसे scientific facts or data information underpinnings of this virus variant समझ आएंगी, वो उस काम पे लगेंगे. But our vaccine enterprise and manufacturers are very alert to all these issues as they emerge.
बूस्टर डोज के संदर्भ में हमारे एक्सपर्ट टीम ही तय करेगी और जो भी मार्गदर्शन हमारे एक्सपर्ट और साइंटिफिक हमें मार्गदर्शन मिलेगा, इस साइंटिफिक मार्गदर्शन के आधार पर हम आगे चलेंगे.
To boost or not to boost. The government continues to deliberate, but the fear remains that Omicron won't leave us with much of a choice. With Ritanshu Bhattacharya, in New Delhi, I'm Shreya Dhondial.
All right, so let's do a quick check now of the countries that are already allowing a booster dose, or rather pushing their citizens to take one. So we're starting with the UAE, which is asking for their citizens to take the Pfizer-BioNTech or Sputnik V shot. There are countries like France which are also asking their citizens to take Pfizer and Moderna in the United States as well. We've seen now in the new policy 100 million doses as booster to be dosed out in the US. Pfizer, Moderna in Germany as well. In fact, Germany is also looking at another contentious aspect of asking, or rather enforcing, making it mandatory for everyone to be vaccinated. No question of not wanting to take the jab there. Pfizer, Moderna again in the United Kingdom. Remember, in the UK, most people have an AstraZeneca shot. They are now mixing and matching as far as booster doses are concerned, asking people to take Pfizer instead. Pfizer again in Israel. Israel already started the booster doses in advance. As far as Czech Republic is concerned, they are looking at Pfizer and Moderna variants as well in their country for booster doses. Meanwhile, Australia is looking at another version of AstraZeneca and Pfizer, Sinovac and Sinopharm in China. And these are the countries that are actively pushing their citizens. For instance, even Brazil now asking its citizens to take the booster shot of Pfizer and Sinovac in Turkey as well. So what's preventing India from coming out with a concrete policy as far as booster doses is concerned? Let's debate that aspect. K. Sujata Rao, former Health Secretary, Government of India, joining us here on the show. Dr. Shashank Joshi, member Maharashtra COVID Task Force and consultant endocrinologist, Leelavati Hospital. Dr. Ajay Kumar, spokesperson of the Congress Party, and Gopal Krishna Agarwal, national spokesperson of the BJP. Dr. Joshi, first to you, what is the basis, sir, of deciding when to open up for booster shots? What criteria are other countries using?
So I don't think we should go by what other countries are using, because they are having mRNA platforms. They have some data on mix and match policy. In India, the predominant vaccination which has been given in the primary schedule, 95% have got Covishield, rest have got Covaxin, a very small sprinkle of Sputnik and Zydus. So obviously we have to look at the mix and match data and look at the science behind it. So there are three likely possibilities which will come up very soon in the next week. Number one, an additional dose, which means scientifically those people who are moderately to severely immunocompromised and they have medical conditions, they will be given an additional dose independent of their primary immunization schedule. That means after 2 doses, even without waiting for 6 months. Second is people who are after 6 months waiting after the 2 doses, they will be given the dose. That is the booster dose. Okay. And third will be the pediatric population. However, what has gone through the Indian experts is, one, having the data which vaccine to give next. Should it be mix and match? People who got Covishield, should they take Covaxin? People who have taken Covaxin, should they take Covishield? That is the first thing. Second is, a large proportion of India was exposed in the second wave. So when you look at antibody surveys, remember, if you have got COVID and you have got two shots of the vaccine, it is as good as a booster shot. A lot of people got a natural booster. So that was also in the back of the mind. And third is vaccine equity. We have seen this with the new strain which has come out, that till we don't vaccinate every person on planet Earth with the first and second dose, COVID is not over. So it's very, very important that we have to look at vaccine equity. So it's a very tight balancing act that scientifically, for the additional dose, booster dose and pediatric population, they are very much necessary, but that is based on science, based on availability and based on equality. So they have to look at all the three factors and take a decision.
I understand your point, sir, of vaccine equity, but Sujata, I want to come to you on this point, that there are enough vaccines now available. There are people who are not stepping out to take their vaccine shots. Since India has not made it mandatory like, Germany thinking about it, they've also not done it. It can not really be enforced. You can't force people to take a vaccine. You can only encourage them. Since those vaccines are already there, existing, what explains the delay in decision then? Why not have those additional doses, as Dr. Joshi is pointing out, right away?
First of all, I would like to say that, I think Dr. Joshi has really summed up the whole issue in a very succinct and a beautiful manner. I think really all the key points have been brought out. What I would, in answer to your question, what I will say is that, yes, we are in a much better supply position where we have a lot of vaccines available. But having said that, there are 2 points which we need to keep in mind and factor. One is that only half the population has 2 shots, the rest of it, and that's a very tall order. I mean, 50% of the population is almost 500 million people yet to be vaccinated with 2 vaccines. That's complete immunization. And there is only that much of capacity that also the government has to be able to reach out to those people. The second is you're saying there's some vaccine hesitancy. I think there has to be, every ward councillor or every collector in a district will know where there are people who are still holding out. And I think the team should be sent there to persuade them. Now with this Omicron tension coming in, there will be that, complacency that might have set in will definitely kick in, and they will get more concerned and go in and opt for vaccination. That's my hope and that's my belief. So I think there will be a quick pickup on vaccinations, and we should really focus fully on trying to cover the rest of the population with 2 doses. But I do understand and empathize with the argument that healthcare, frontline providers who are providing and interfacing with the patients on a regular basis, they need to be getting a booster dose, and also those elderly who have comorbidities.
Yes.
But then at the same time, as Dr. Joshi has said, we must look at the science very closely. What he has explained very well, we have been all exposed. We do have enough antibodies. And will a booster dose really add further, is it a psychological comfort, or is it really needed for us to fight this new variant, is what they have to match.
Okay.
Because what is it? It's a terrible choice we made, and it shouldn't be this or that. Ideally, both. But if we have to make a choice, I would really say that those who have not been fully immunized should get it.
All right.
Having said that, the last point I would like to make is that the government must come up with a set of incentives and disincentives to try and nudge the people to accept vaccination. I don't like this Kerala policy of saying we won't treat you free if you don't take vaccination and get sick. That's not nice. Or the Madhya Pradesh government saying that we won't give you rations if you don't. You can't punish people. But you certainly can disincentivize, like we've done for tobacco, that, you can't enter a movie hall and smoke. You can't enter a restaurant and smoke. So if you want to smoke, then you have to stand out in the cold. Those kind of disincentives you can have, where restaurants are not open if you're not vaccinated, or you can't enjoy certain other freedoms if you are not fully vaccinated. That's okay. And those kind of incentives is what we need to give. For the poor people, it would be most ideal if we can give additional rations and additional incentives to get them come forward and accept the vaccination. But punishing people is not public health.
Fair enough. Incentivize vaccination rather than trying to punish people for not getting their vaccinations done. But is the government open to all these suggestions that are coming forth? Gopal Krishna, I want to ask you that question. The government in the past, especially in the second wave, has been accused by opposition and by others of not being prepared. Isn't a booster dose a way of preparing for a possible third wave to keep healthcare workers specifically who got their doses way back in January and February, and other frontline workers safe?
The thing we have to understand that what Mr. Mandavia today in the floor of the House said, that it is the scientists who will take the call when this third booster dose is to be given, is it to be given, whom it is to be given. It's all scientific, and the government is well aware. And we are also aware that there is a politics being played by opposition in whole COVID-19 pandemic cases, and how the government was at many times of in the past was pressurized into taking some decisions which were not, which in the hindsight would have shown that they are not very conducive. So the thing is that the government has to depend on the suggestions and on the base, and take decision based on research and the expert advice, and also look into the logistics and all those things.
What are these pressures by the opposition that you are referring to, which you believe in hindsight would not have worked?
They were saying that why should we have an Indian vaccination? Why don't we import at that time? Then there was a vaccine hesitancy
because there was at that time a question of shortage of vaccines. Dr. Ajay Roy, I want to come to you now.
But then, then it would have derailed the whole process. Ultimately, you have to believe the government that it will listen to you, but you cannot pressurize and put
But sir,
pressure
you
on the government.
will accept the fact that the second wave hit us when we had only just started vaccinating 18 and above, and many people, you know, would have had some sort of protection if there were enough vaccines at that time.
Yeah,
So just a second, I'll come back to you. I'll come back to you.
No, just 10 seconds. If at that point of time you had asked anybody, Pfizer, Moderna, they were not ready to export their vaccinations. And if government had not taken its own initiative on developing indigenous vaccination, the cost would have been exorbitant.
Okay, there was an issue of indemnity. Okay, you made a point there. There was an issue of indemnity, and perhaps that is the reason that vaccines at that moment could not be imported. I want to go across to Ajay Roy now. Ajay Roy, you know, as we've just heard the spokesperson there of the BJP saying that the scientists will decide when booster shots are to be given. I understand that in the INSACOG bulletin, the Indian genome scientists have in fact recommended a booster dose for COVID-19 vaccines for those above 40 years with a preference to high risk and high exposure population. Do you think that the opposition in that case should be putting more pressure on the government, not acting as just a critic of the government, but also trying to push them in the right direction in this pandemic in which we are all together?
So first correction, hygiene factor is Ajoy Kumar, not Ajoy Roy.
Sorry.
So yeah, no issues at all, because I mean, Roy is a nice name, but unfortunately it's not mine. The other part is I'm amazed with my colleague in the BJP from the BJP is speaking, because they never vaccinated till January, and the opposition was the only reason why they were getting exposed. And despite that exposure, lakhs of people died. There were bodies in the Ganges. You know, the Gujarat, the numbers of people are 10,000 officially. There's going into lakhs, and umpteen number of channels across the world, across India, everybody is reported on the number of deaths and the mishandling, whether it's oxygen, everything else. So with all the opposition's criticism, they had such a thick skin to ensure that the second wave was such a disaster is also a credit to their inability to respond to what is necessary for the people. And seriously, the way we handle the second wave. Now, I definitely say that the vaccination India is moving in the right direction as far as the vaccination is concerned. So give them credit where it's due. But where they awfully failed was in the second wave. Where they awfully failed to predict was with all the kinds of activities they did, from the elections to everything else. And all of us are responsible, but obviously they're in the government, so they're more responsible. But right now, I think my distinguished colleagues before that, Dr. Joshi and Sujata Raoji said correctly that the first thing is to vaccinate the rest of the pending population. The second is to believe in the science of it, only to be dealt with science, only to be driven by the scientists and not by political objectives. The third important issue is that across the world, and it's not something which you need to learn. There is a drug called molnupiravir, which is a Merck medicine, which has been approved. Now, whether it is suitable, not suitable, a team can suggest. We don't have to have a situation where remdesivir was suddenly, or ivermectin or suddenly was the drug of, and everybody went crazy and to realize that it doesn't work at all. So first question is, there is adequate data on antiviral drugs available. Can the government stock it for people? Yes or no? What are the guidelines? What are the strategy to ensure that the rest of the population gets vaccinated instead of taking pot shots at the opposition, which they seem to only do and waste their time on? Is to put up a clear-cut, how do you vaccinate the rest of the 50% of the population has not got the second dose, to ensure how do we ensure that that happens? And the other part is to continuously brief daily the country on what is the situation. Are we prepared to, our labs prepared to do the genomic sequencing of the new variant? Are we adequate in that? As to do an audit across all hospitals and ICUs, that what we said and what we are tom-tomming on the TV and media in terms of, no, I'll just finish. And the most important thing, I think, irrespective of India, if the rest of the world is not vaccinated, and it's a serious issue, and only 8% of Africa is vaccinated right now, rest of the world, some people have. So, like Martin Luther King said, that if you don't hang in together, we'll all hang separately. Now, we need, whether it's getting rid of, and India correctly took a stand, and I want to credit the government on that, on trips. is that whether you release the iron caste rules for the intellectual property for these vaccines, because the world is facing a challenge.
Right.
India has raised the issue, but the Germans and the European Union don't seem to be budging.
Yes.
But we must make sure that the whole world gets vaccinated along with our strategy to get, because
absolutely.
Yeah, otherwise there'll be some other variants
vaccine
coming
inequity is leading to a crisis when newer variants are emerging, and that's the reality which even the rich countries need to understand, because they have stockpiled many more vaccines way back. For instance, in the UK, per person, some data reflected that about 8 vaccines were pre-ordered by the United Kingdom, whereas, as you are mentioning, in Africa, there are countries with vaccination as low right now as only 5%. Ajay Kumar, sorry, very quickly, you raised several points, sir. The parliament is on. Why aren't these points pointedly being raised by the opposition so that we get an answer from parliament, from the government?
No, so it's very good question. Have you ever tried to raise any issues with this government? I mean, it's worse than a root canal or a tooth extraction. You can't, they don't agree to debates. They don't want debates. They will make sure that it is confrontational. The Prime Minister will talk so sweetly and say, I want discussion. But on the ground, it just doesn't happen. The opposition is, that's why, forced to raise these questions outside the parliament. Well, forget that. You journalists are not allowed in the parliament. They don't want you to
but
report.
the opposition is allowed in the parliament, right? And we don't expect adjournments after adjournments in the Rajya Sabha rather than important issues being raised. I'll stop you there because we are running out of time. Sorry. I'm very sorry. I need to go to the other two guests as well. Dr. Joshi, very quickly, I also want to understand from you, since this variant Omicron is new and we still don't know about its immune escape, then this brings us also to the point, will boosters even be effective?
No, I completely agree with your question, but whatever you may do, vaccination always will boost your immunity for sure, even if there is an immune escape. Currently, whatever we are saying about Omicron is informed speculation. And I don't think we have hard data. So, we should not speculate. As scientists, we should be observant. Let 2 to 4 weeks go. We don't know which vaccine will work, how effectively it will work, what would be the immune escape. But whatever are the early observations from South Africa, it seems that the vaccinated population is doing better and getting milder disease, which is a reassuring sign. One thing is clear-cut: vaccine save lives, and vaccine saves severe disease in most of the people. And that is a standard yardstick. So I think an additional dose in those immunocompromised individuals is definitely merited. And I'm certain that in their wisdom, in the near future, Government of India will come out with a policy.
All right. So, Sujata Rao, there were several questions that were raised by the Congress spokesperson here, and the BJP spokesperson was also raising questions. Do you believe, as a former administrator, that these questions need to be answered in Parliament so that the country can know about it?
Ideally, yes, but this is not the moment. I think right now we are still struggling to get back to normalcy. And what both the speakers were referring to, what happened in the past and who failed and who didn't take timely action and what were the consequences because of that. They are very, very important and vital questions that we must document so that it doesn't happen in future. There are a lot of lessons to be learned. But right now, at this moment, I think if the politicians could agree to allow the scientists to do their job and listen to science and not to politics or superstition, and let science lead the solutions for us, I think we'll be much better off and we'll be able to save a lot more lives.
Okay.
I think it's very, very important. People are scared. People are worried. Their lives have been disrupted. And I think every political party owes it to the people who have elected them to see that the people get a sense of comfort, to say that everyone is united and they're behind the people to ensure that, that we get back to normalcy as quickly as possible.
All right.
I'm one of the few who don't agree to this lockdown and harsh measures as public health measures. I don't agree with that. I think we just have to learn to live with the virus. It's mutated now. It's going to mutate again after another 3 months. Let me tell you that. So virus is going to carry on and we cannot keep shutting ourselves with the night curfews and day curfews and stopping international travel.
So, ma'am, I'll interrupt you there. I have the last 1 minute left. I'll give it to the two spokespersons. Ajay Kumar, I'll come to you, but before that, 30 seconds to Gopal Krishna Agarwal. Gopal Krishna Agarwal, if we don't, admit that we failed at some stage during the pandemic, how do we rectify the mistakes then? And this stands even for a decision then on booster doses.
No, there is a difference between the failure and the way the government tried with full intention. There were certain challenges and those challenges have not arisen just because of 6 or 7 years. It's a challenge of health sector from the independence and before that.
All right.
So the thing is, but what Mandavia ji said, that at this point of time, the politics has to be kept aside.
Okay.
And
Ajay Kumar, 30 seconds to you. Make your point. Sir, I'll stop you there. We have run out of time. Ajay Kumar.
First of all, I was surprised that I knew they would come back to blaming Pandit Nehru. But the important point is, even masks. No, one sec. Can I complete, Agarwal, sir?
Yes, please, 30 seconds, sir. I have to wrap.
No, the advisory on crowding, the advisory on mask. The mask is one of the most important. So we might think of vaccine, but we don't have an immediate solution on all that. But I think fundamentally, now if you go around any part of India, masks is more by default than by what is necessary. So masking is a huge preventive in terms of spread.
Okay.
So I think the government should get active on that part.
All right. And, many thanks all four of you. I've completely run out of time. Many thanks to all our panelists for joining us here on the show. The need of the hour, apart from, of course, having a policy on booster, as Ajay Kumar mentioned, the need for the citizens at the moment is to mask up, because that's your basic protection against the virus. Many thanks for joining us this evening. Taking a very quick break.